Medical marijuana benefits. What conditions can marijuana treat?
Medical cannabis has been used to treat many conditions over the several millennia that it's been used. However, in modern day medicine, which is evidence-based, I think the best science is in the area of pain reduction or analgesia. It is a non-addictive alternative to opiate drugs for peripheral neuropathy, which does not respond very well to the typical opiate drugs. And that peripheral neuropathy is most common in persons with HIV and/or diabetes. It's useful for the anorexia and nausea that's either directly caused by disease or caused by medications for diseases such as cancer chemotherapy. A number of trials have shown that it's very effective for cancer pain and terminal cancer. After that, I would say multiple sclerosis is one of the areas where it's most widely used. Some people have recommended it for glaucoma, but there are some pretty potent drugs for glaucoma that are topically used and don't require ingesting a compound like marijuana or THC, so that seems to be the preferred way to use it.
Do most physicians believe in the power of medical marijuana to treat illness?
Most physicians will not admit to believing that marijuana or medicinal cannabis is useful except in very rare instances. This, I think, is the result of the misinformation and myths about marijuana and medical marijuana that have been propagated by the U.S. government ever since the war on drugs began back in 1937. And the fact that the double-blind, placebo-controlled studies are just now coming out, and people who have spent their lives believing that marijuana is a highly addictive and dangerous substance are not likely to read or even believe that data. So I think we have a long way to go in educating America's physicians, nurses, healthcare practitioners about the truth and the usefulness of medicinal cannabis so that they will feel more comfortable using it. And that really is the purpose of the organization, the Medical Marijuana Policy Advocacy Project that I and others have established.
Why is medical marijuana an effective way to treat nausea?
Marijuana is a very effective way to treat nausea because it can be very easily titrated by the patient, most of whom only require a few puffs of smoke or a small amount of vaporized gas from marijuana. It doesn't have other side effects, and it will not only treat the nausea, but it will increase appetite, whereas anorexia often goes along with chronic nausea from cancer or chemotherapy, and so you're really getting two benefits at the same time.
How does medical marijuana help people with glaucoma?
Well, medical marijuana is supposed to decrease intraocular pressure, which is the actual cause of glaucoma or the pathogenesis of it. The mechanism I'm not exactly sure of. It opens. It presumably opens up the canals through which the excess intraocular fluid can drain. But at the same time, we have topical agents that are very strong, very effective. They're usually prostaglandin-derived compounds, and so I don't think that medicinal cannabis is going to get very widely used in this area.
What do HIV/AIDS experts say about medical marijuana?
I would say that if you surveyed all the different medical specialties, it would be the HIV, AIDS, and oncologists that would be most enthusiastic and positive about medicinal cannabis, at least in those states like California that have state-sanctioned and